history of Minnesota oncology dates back to the 1960s, when the first trained medical oncologists began practicing in the Twin Cities. It is the first and largest independent oncology practice in the state of Minnesota.
In the 70s, 3 physicians left their practices to join a private practice, and I had the privilege of being the 4th person in this organization. And the reason that we came together as an organization was to be able to provide high-quality, evidence-based and patient-centered care closer to the community so patients did not have to drive long distances for their treatment. Minnesota Oncology's longevity has allowed us to look at the past and the present and the future. And I think we're developing the infrastructure based upon the past experience to continue to provide the best cost-effective care that's highest quality now and into the future. Patient-centered care is about a friendly environment, it's about supportive care, and it's also treating the patient in the most effective, evidence-based, cost-effective manner.
Minnesota Oncology's mission is to combine the strength of hope with the power of science, one patient at a time.
Minnesota Oncology is very unique. It's probably the largest concentrated group of oncology professionals working together in a metropolitan area. That allows us to have depth and breadth of expertise that's essentially unexcelled outside of the largest cancer centers in the country.
You feel like you have a whole team working with you. You're not just seeing a doctor, you're seeing a whole team of people. And like I said, I couldn't have been treated better.
Minnesota Oncology patients have access to a variety of services, such as social workers, dietitians, a survivorship program, support groups, educational opportunities, clinical trials, financial counseling, and genetic counseling. All of these services are provided by highly trained clinicians and encouraging staff members who are among the most talented in the region.
I really appreciate a team approach to cancer care, and that's one of the reasons that I've really appreciated being part of Minnesota Oncology.
Minnesota Oncology believes in a firm partnership with each patient throughout his or her medical experience. Whether it's personalized medicine, innovative symptom control methods, or the expertise of a surgical subspecialist, Minnesota Oncology works with patients to develop a treatment plan based on the most current research evidence, technology, and patient wishes.
I really believe the connection is the key. I came here, I met the people here, I met Dr. Saborov, and I felt completely comfortable and completely like I was in the right hands.
With a history of innovation, Minnesota Oncology uses state-of-the-art therapies and research to fuel its ongoing dedication to continuing advancements in the treatment of cancer and blood disorders.
There are so many new therapies coming out, and I'm so happy to be able to offer clinical trials to our patients. I think it gives them frequently the opportunity to have a new medication that might be promising.
Number one, I think Minnesota Oncology provides patients the best care possible. Secondly, we have access to multiple clinical trials, both through the community oncology trials and then specialized trials which are coming through Minnesota Oncology. And we are everywhere in Twin Cities, so I don't think patients need to travel when you are sick.
Minnesota Oncology is just unbelievable. The whole thing, everybody is working towards a common goal. And when you come in as a patient, you can feel it right away, that common goal is you.